Okay, it's Dr. Buford. We're just getting started. Oh, is the bag on suction? Can you turn the suction off on the bag, please? We're just getting started on the right shoulder. We're looking in from the back to the front. That's just due to gravity. Everything you see is magnified 30 or 40 times on the screen. Give me a little more slack on that one. And so here's, right out of the gate, we can see the problem, one of the problems. There's the torn biceps right there. See that? And that's exactly what we expected to find. See that? On the back side, that's what it's supposed to look like. But on the front side, you've got this tear. And so we're going to take care of that. We're going to smooth out the labrum a little bit here. But the next step for us is to pass a spinal needle through the biceps. So we'll get that going. Okay. So we'll take a spinal needle and we'll pass that through the biceps with a little bit of luck here. There we are, going right through the middle of it. We're going to pass a black wire called a shuttle relay or a super shuttle. Grasper to me. I'll get field scope, I'll get all that. And so we'll grab this. Next we're going to load this with a suture. Doesn't matter which color. And then we'll pull back. And you can see that suture going through. So now we're going to repeat the process one more time with the spinal needle. This is going to be a little bit more difficult because I'm trying to get even more distal. That looks like a pretty good shot there. Okay, I know that's going all the way through. We're just trying to put something through to hold the biceps in position before, while it heals. Hold the camera here and I'll do that. So this time we're going to feed a bunch of the relay through. And if you watch carefully here, you'll see a little extra trick that we do this time. We're going to grab the relay just like before, back the needle out, and then here's the trick. We're going to let go of the relay. We're going to sneak around behind the backside. And now we're going to get it just like that. And so now when we load this, especially with a torn biceps like you have, this is going to give us a stronger stitch going through it twice and then around the back. That's what we sometimes call that a purse string stitch. Watch what happens when I pull tight. See how that goes all the way around there? So now we'll take a pair of scissors, and we will, arthroscopic scissors, and we will cut the biceps at its base. Okay, and so now that is no longer a problem. We will go ahead and put in our shaver just to smooth out some of what's left behind here. And now as we look around the rest of the shoulder, I'm going to look down the back. This is posterior joint. Looks pretty good here. Posterior labrum and glenoid. This is posterior humeral head. We'll come around the front. We'll look at the rotator cuff, which is right here. You've got a little bit of fraying, but not bad. Okay. And then we'll look down the front of the shoulder. Here's anterior glenoid. And this anatomy. And these structures look pretty good. There's the subscapularis tendon in the middle glenohumeral ligament coming across. Okay, so now we're going to go ahead and finish up inside the joint and have a look in the subacromial space. Okay, so we're all done now. There's the bicep suture tied. We looked at the rotator cuff, and it looks great. No signs of any rotator cuff significant tearing here. This is all the way posterior back here. As I externally rotate, that's all the way anterior there, and that's why we're bumping into the biceps. We've done a decompression. You can see the bone is nicely smoothed out in the front. We did a little bit of a distal claviculectomy also. And so now we're going to finish up and get you back to the recovery room. I really hope this does the trick for you, okay? Bye-bye.